Now we're bringing you in-depth coverage on a news alert we first told you about yesterday. The flu is widespread in Rhode Island once again. This is the second wave, and it's even more intense than the first. Joining me live now in studio is Dr. James McDonald with the Rhode Island Department of Health. How are you?
I'm great. Thanks for having me tonight.
Thanks for coming in. Let's get to some of the stats here right now. I'm looking at this. 13 people have already died so far. I know dozens more have been hospitalized. So let's talk about this. Who are the people most at risk?
Well, the people most at risk right now for a severe problem with flu is the elderly. And that's really the message tonight. The elderly are at risk. We really need to get the flu vaccine. If you haven't gotten the flu vaccine already, there's still vaccine available. The other message I'm going to send to not just to the elderly, but the folks who are around them, you need to get the flu vaccine. You need to protect your grandma and grandpa because quite frankly, the strain we're seeing is really affecting the elderly.
Absolutely. So I know we've already had this first strain that came around. This was back in January and February. I know because I actually had it myself.
Yeah, sorry about that. Yeah.
Yeah, it was no fun. But it's kind of strange to be talking about it at this point.
It's unusual, but it happens. But this is a second wave. We saw the flu in January, a peak of it like we would expect it into February. But now we're seeing a peak now, just as much as we saw then. And so the flu has come back. It's a little bit different strain. It's influenza A and B we're seeing right now. And yet the vaccine that we have does cover those strains. I think the other thing for someone, if you're getting the flu symptoms, there are antiviral medications that you can take. And so, flu, when it comes upon you, suddenly hits you like a truck. Fever, chills, you feel terrible. Hurts to comb your hair. It's bad. But there's medicine you can get. If you get it within the first 48 hours, that antiviral medicine will help you and will shorten the duration of your illness for most people.
So even though it's a different type of flu that we had before, it's still the same symptoms, still the same way to handle it?
It's the same symptoms. And the vaccine we give folks has more than one strain in it. So we're covered. We just need more folks to get it. You can get the vaccine from your doctor. Pharmacies still have it. And if you're stuck, call the health department. We'll find a way for you to get it. 222-5960. We'll help you get that flu vaccine.
Thank you so much, Dr. McDonald.
My pleasure. Thank you.
All right. And also make sure you go to our website, WPRI.com. You can find extended coverage on this second wave of the flu season right now. We've posted a flu resource guide from the CDC on our homepage. It answers important flu questions and includes an interactive quiz to test your flu knowledge.